Okay. So we are now recording. Welcome everyone. Thank you for joining me from all around the world, Australia, US, Canada, all around the UK, Spain, France. Well, I'm in Wales and I know some of you are in England as well. So welcome. Oh, I'm Portugal. Welcome everyone. Poland. Oh, you're in Poland, are you? Gosh, oh, welcome. Wow. Thank you. Okay, well, I'm going to start with the first question, which came from Angela. And she asked two questions, actually. What would the ideal frequency be for somebody with unilateral lymphedema? Because in my research, and that is a good question, but I think largely it depends on how often your client is available to come. In the research, I chose to do it once a week because I wanted to do 4 treatments. I needed a baseline week and a follow-up week. So that was done over 6 weeks. I was also restricted with that because of time and it being part of the research and a part of my university work as well. So that was my reason for choosing that. Also, patients used to come into the clinics at the hospice of the valleys where I was working, and they were just weekly clinics. So weekly seemed like a reasonable way to do that. But I do know if somebody has extreme swelling and they're having bandaging and the decongestive therapy with bandaging, then they do MLD, so manual lymph drainage is done daily. Now, my rule of thumb is with RLD is if MLD is okay, then RLD is okay. So I hope that answers that question. It's a bit of a difficult question to ask because the other thing, you're maybe putting financial pressure on people if you're telling them they have to come each week or each day, so that's really up to you and the client. I would say it also might depend on the severity of the swelling. So what we found when it's a larger limb, it takes longer to get the swelling down, because the body can only return so much fluid at any one time. Okay, so I hope that answers that question. Just welcome the other people who are joining us. Thank you. Thank you for joining. I can see names, but not videos, but welcome anyway. And just to let you know that we are recording. So Angela also asked another question, which is an interesting question that I haven't been asked before. And I only have very limited experience of this, so I have to fess up. So how do you plan a reflexology treatment differently if the client has their inner organs are reversed with no health defects? Now, I didn't even know this could happen, but there was somebody on the course I did at university who had this. And basically, you just need to reverse the foot map. You just need to reverse the foot map. So if you thought you were working the bowel in a clockwise direction, you'd have to start on the other foot and work that. Or that's what I would do. But some people might go through their life not knowing that they have that. I believe that person on the course found out about it as a result of her experiences of receiving complementary therapies during the training.
Well, this lady only learned at the age of 50. And like she said, she hasn't suffered anything up to now. But yeah, it's very strange. I hadn't come across it before. So
that is really how to confuse a reflexologist, isn't it? We all have, or I personally have that whole left, right, left thing.
Yeah.
Have to reverse it again. And then if you're doing it on the hands as well, I think that could. Anyway, so I would still do a treatment, but when you're thinking of a specific, or kidney to bladder, that's okay, both feet. But you'd want to work the liver and gallbladder on the opposite side and the spleen on the opposite side. And I guess if there are drainage issues, you'd have to think about the left side normally is draining 3/4. You'd be looking for differences in the right side. Yeah, it is fascinating. But good. It's good that she has no problems with it.
It came out from a scan of having a coil fitted. believe it or not. And the story unfolds into a can of worms, so I won't lengthen that, but yeah.
Well, that would be an very interesting case study.
I know. Thank you.
Thank you for your question, Angela.
Thank you.
So my next question is from, I've also done them in a list in order that I received them and wrote them down as well, because I always like everything to be fair. So my next question was from Sandy, who's with us here from France. Sandy said, if you're including RLD in a general reflexology session, at what point would you use it? Now, I would say no rules really. It's up to you with the client. It also depends how much time you have with that person. You may choose to just work the lymphatic system. If you work through the systems as you do your reflexology, you may choose to just work the lymphatic system using the RLD sequence when you come to work that system. That's not what I do. But again, I wouldn't say any is right or wrong. My way is I kind of whip round the lymphatic system to start. So I'll do moves 1 to 7, so quickly round. But when I'm talking about 4, 5, and 6, so the 3 upper lymph moves, I wouldn't do 3 of each one. I'd go across the first time, clear under the arm. Second time, I'd go across and do the kind of deltoid shoulder. Third time, I'd go across, pump under the arm, sweep down, work the lower lymph, and then I'd start my treatment. So you've kind of had a quick flush around, because I think when you work like this, when you work the subclavian vein, cisterna chyli, these 2 reflexes give you a lot of information, even if somebody doesn't have lymphedema. I think these reflexes tell you if there's inflammation going on, if they've been lethargic, if they haven't been sleeping well. I think you get that. The client will feel that bruised sensation, and for you it might feel very congested or blocked or stagnant, you know, whatever however you would describe that, the same sort of thing. And then at the end of my treatment, I would whip round again, and then finish with the, you know, nice kidney to bladder flush and some linking. I would find it very difficult to do a reflexology treatment now without using some elements of RLD, because I see how it flushes through the whole system and makes a big difference. So I hope that answers your question, Sandy. Yeah? Okay, thank you very much. Okay, my next question is from Dee, who is with us here. Hi, Dee. It's one of those questions where somebody's asked her if she would be able to help somebody. So I'm going to read out whether to treat her. Somebody's asked whether or not she'd be able to treat her auntie who's in her 70s, extremely overweight, sits in the chair most of the day, moves very slowly on a Zimmer frame throughout the day, and has had flare-ups of cellulitis over the years. These started 20 years ago, but she hasn't had any recently, so nothing in the last year. Firstly, I want to say there that RLD is only contraindicated if there's a current episode of, during a flare-up, during an episode of cellulitis. Once the cellulitis has passed and they've finished taking their antibiotics and they've recovered from it, RLD is fantastic, I would say, for that. But this is a complex case because, firstly, you don't really, if you don't know the client, if you haven't seen them, you don't know what else might be going on. So what might be causing the swelling? Because you also added here about it being a contraindication, and that you said that the hospital used to drain her legs of the fluid, but your client believes that they gave up on her years ago. Now, when you say drain the legs of the fluid, see, this is the sort of thing you would need to know more information about, whether they're doing manual lymph drainage, whether they're doing compression bandaging to help drain that way. But also understanding the cause of the swelling will help you decide, together with what else is going on. So I wouldn't say it's contraindicated, that person would be contraindicated, but I would wait until I saw them and did a full consultation to understand how I would adapt my reflexology, whether I would use elements of RLD or not. I've made a note here. I think this is one of those things of managing expectations, because as RLD is gaining momentum and we're seeing people sharing the most fantastic results, worldwide people are sharing their results, which is fantastic. Other people are seeing this and think, you know, maybe they've got really swollen legs and they're kind of desperate for some help. And they think, if I have that, then I'm going to improve. But it might not be the same for everyone, because the cause of the swelling, you need to understand the cause of the swelling before you decide how to adapt. And also you'll be carefully managing their expectations too, because there is a vulnerability with people with health conditions such as that, who are maybe desperate for some help, especially if they feel that the health service has given up on them. I'm sure the health service hasn't. So I hope that answers your question.
Yes, absolutely. Thank you. Thank you very much, Sally.
You're welcome. Thank you. So our next question is daughter. Is that how you say it? Daughter, thank you. Okay, who is currently in Poland, so welcome. So she said, I've a lady, she had a call from a lady with lymphedema on her upper legs, trunk, upper arms, and just wondering how to treat her, whether to work on the hands or whether to work on the feet. Now you could do either, that would be entirely up to you. Because with RLD, when you do those moves 1 to 7, what you're doing is getting that lymphatic system going. And once you've got it going or moving around, you're creating that vacuum that, if you remember, when you're trying to get the lymph moving, you can't push it because the system is full, if you like. You need to open the drain, open that subclavian drain point, so all the fluid can start to return back to the circulation, and then you create a sort of vacuum in order to draw more fluid into it. So by doing moves 1 to 7, you would technically already start moving the lymph. So it would already start drawing in from the interstitial spaces into the lymph vessels, entering the initial lymph vessels and starting to move. So if somebody had upper edema, you know, arms and legs, then I would add in both moves. So I would add in what we do for unilateral, so breast and arm, or you could leave out the breast if you wanted, but no harm in adding it in as well. And I would also add the leg reflexes in before I then finish the foot with a nice kidney to bladder flush. So I hope, does that answer your question? So you also said your case study is somebody with lymphedema of the trunk and upper legs, and that you worked on her feet and had good results. But this lady also has lymphedema in her upper arms. Okay, and you're just trying to do your best to support her. So you've got some good results. Did you do the arms and leg reflexes? Would you like to unmute?
Just the legs.
Oh, you just did the leg reflexes. And did she still get some sensation in her arms?
Oh, yes.
Yes. Okay. Yeah. Great. So there would be no harm in adding arms and legs, and that. So I would do 1 to 7 to get it all going, and then after that, add in arms and legs. So again, go back to understanding the pathology of what's causing the swelling, whether it's primary lymphedema, whether it's lipodema, or whether it's obesity related. I think when we understand it, we know more about how to help it move. So with very stubborn lower limb edema, it's quite hard to demonstrate here, but I'm going to do it. So with very stubborn lower limb edema, if the client is here, if that's the client's foot, I like to pump. So I would pull the heel towards me in order to pump. But what I'm actually doing is pumping the lower lymph, and also some ankle rocking. So anything to help that stubborn lower edema, because remember, it all has to travel up the body, up to subclavian vein. So or any help that you can give it. That's how I would do that. So does that help? Does that answer your question?
Yes, thank you very much. Thank
You're
you.
very welcome. Thank you. Okay, so Yin in Melbourne, in the not Melbourne,
Sydney.
Sydney. We met in Melbourne though, didn't we?
We did.
Yeah, we did. I knew.
For the class.
But for the record, I preferred Sydney to Melbourne. Oh, we loved Sydney. Anyway, so your question is one that I don't get asked very often, and I don't have a lot of experience of it. So your question is, can RLD be used on a baby, and at what age? Now that's a kind of a general, that's quite a big question. So to that, I would say, again, go back to my safety net, which is if MLD is appropriate, then RLD would be appropriate. And I would always try to mirror the sequence and the MLD sequence that they're following. So if they drain one side first, I would do the same. I would repeat the same on the foot. But I do know there is a rare form of primary lymphedema that can develop in children at birth and very early on. And I believe they manage that with as best they can with MLD. So I would be looking to mirror whatever they're doing for that. But apart from that, I didn't really understand why you might be wondering about RLD on a baby for anything other than lymphedema. Do you have a particular case in mind?
Yes, the baby has an allergy.
Okay.
And mother has to go on a special diet.
Okay.
So that the baby don't have the allergy with soya.
Okay.
And dairy product.
Okay, and what effect does it have? What does the allergy do to the baby?
Baby becomes restless,
Okay.
not sleeping well.
Okay. I mean, I have to be honest here, I don't have a lot of experience with working with babies, but I do think that reflexology is wonderful for babies. But obviously it's very gentle and you have to it's a short treatment. So maybe look at some of the other training providers who do work with babies. But I think you just simplify it right down and use the horizontal zones rather than working deeply in reflexes. I think it's just more gentle and a short treatment. But if I had a restless baby, I would certainly give it some nice gentle reflexology. Digestive issues, I'd very gently, work clockwise in that horizontal zone. That's what I would do. Okay. I'm not sure I would do RLD because I think it might be hard to work those reflexes on very small feet because they're very specific, aren't they? Getting high in the upper lymph and the cisterna and I'm not quite sure that you would be able to put as much detail in. But I do think definitely reflexology for babies is wonderful. Absolutely wonderful. And there are some quite nice books around about that, working with babies.
Okay.
So
does it help? Yes, thank you very much.
Thank you. And I've just got one more question on the list, which is from Maria, who is from South Africa, but I don't think she's with us. But I'm going to answer the question anyway. It's, if I incorporate RLD into my existing reflex treatments, do I do the linking and bladder kidney reflexes at the end of the full treatment? So that's kind of the same or similar question to Sandy was asking about when and how I would incorporate RLD in. So there are no hard and fast rules. I'm very biased towards it because I see the results regularly all the time, and I would struggle not to use parts of it now. But even if you were doing a standard reflexology, I think once you've done this training and you've got your head around the idea of moving all the lymph and you see the results for yourself, you will, even if you're not doing RLD, you will still pay attention to the subclavian vein and the cisterna chyli reflex, which will give you information. And if they feel blocked up and congested, then you may choose to work the lymphatic system. You know how when we're working normally, we would adapt our treatment as we go, depending what we find. You know, it's actually harder to stick to three of those than to, you know, for example, if you get to the shoulder and you think, oh my goodness, what's been going on here? And your client might say, oh yes, I've been doing a lot of work at the computer this week or something. You know, it's actually how we work. We feel something and we give it a little bit of extra attention. So thank you everyone for your questions. I'm just wondering, does anybody have any questions that you'd like to ask? Anybody who's here, would you like to unmute? Nikki, there we are. Would you like to unmute first?
Yes, I just wanted to ask, if you have somebody who isn't presenting with lymphedema, but they do have other issues, maybe fibromyalgia or something like that, or some kind of inflammation or autoimmune thing going on, which I know RLD is good for, do you do in your treatment the leg reflex or the arm reflex, or a mixture of both within it?
I might do both, either or neither.
Okay.
It would depend. I wouldn't really have rules about that, because it would depend on the individual. So for example, if somebody had chronic fatigue syndrome, so kind of part of the whole fibro, ME, chronic fatigue, but no pain, they're just fatigued, I would do a very slow, gentle moves 1 to 7. I might not do the arms and I might not do the legs. I might just do a gentle, slow, shortish treatment over 2 feet with, you know, kidney to bladder flush, finishing with some linking. And, you know, I might do a little bit more work around the head as well to try and, you know, relax the nervous system a bit. It would be a very gentle treatment because you don't want to overload someone. In my experience of working with clients with fibromyalgia, I used to see a lot of people with this condition. It was as if I was attracting them. You know, in my early days, when I was working at the hospice, a lot of my private clients were people who would come under that umbrella. And I noticed that some people used to be more affected in the upper body, you know, shoulders and arm. That would be where they'd get, if they were having a kind of episode with fibro, they'd get more upper body, or some people it might be their legs. So I would do either to suit them, or you know, if they were having, if their upper body was bothering them, I do the arms. If their lower body was bothering them, I do the legs. Equally, if there was somebody who was an athlete, who was somebody who might go for sports massage, I would do RLD and I would do arms and legs to give them a whole, you know, that whole sort of flush everything out. And I've had people in that category who've said to me, my God, I feel like I've had a sports massage after that. So a gentleman who was very reluctant, he didn't really want to be there. His wife had made him come, and he sort of sat in a chair, and how long is this going to take? And afterwards he was like, oh, I feel like I've had a sports massage. And I just did RLD, arms and legs. He rebooked and came back too. So fibromyalgia, other conditions, I would just tailor it to the person in front of me. And it might not be the same if one thing's hurting one week and something else is hurting the other week. So does that help?
Yes, definitely. Thank you.
Thank you, Nikki. Does anybody else have any questions that you'd like to ask? Okay, Jean in Canada, would you like to unmute?
Yes. Hi.
I do.
I just did your course last week, so I haven't really practiced the RLD, but I did have a very interesting experience with one of my regular clients this week that I wanted to ask you about.
Okay.
When I was doing the lymphatic areas, the breast lymphatic, she mentioned on both feet that the area was, a certain spot was very tender. So when I told her what the area was, she looked at me kind of surprised and said that she had a lump biopsied in her left breast, which turned out to be benign, but in her right breast, there was actually a blocked lymphatic duct or node, and she is getting monitored for that. Every year she has a scan or something. So she's quite worried about it, but I was just very surprised that, first of all, I picked it up and was just wondering if the RLD could actually help with the swelling in that particular area to go down and possibly open it up at some point for her.
Well, well done for picking it up. And
Yeah, it's great.
how great is it that we still love it? We just still love reflexology when we pick things up, and you just don't lose that, do you? So I would like to think that flushing the lymphatic system might help to unblock this for her. So I would be very interested to hear. So she didn't tell you about this. You just picked up on it, and with the lymphatic stuff. Did they say what's causing the blockage on the right side?
She had no idea, and from, she just said, like, they don't know why. They just told her it's blocked to the point where it's swollen and they can pick it up in scans.
Okay.
But of course, she is quite concerned that it may turn to cancer, or get bigger, or she might have to have a surgery or something later on.
Yeah. I mean, I think women, I wouldn't like to guess this, but depending what age she is, women can have a sort of calcification sometimes. I think that's
She's early 50s.
Okay. Okay. Did she give you any feedback, follow-up feedback afterwards, or has she rebooked? Would it be
Well,
safe?
she's rebooked for sure, yeah. And I told her that I was hopefully going to contact you and just ask for your opinion on, because it might be a case where if you think it would be a good idea, then I would just switch over and do the RLD on her rather than the straight reflexology treatment.
Well, my benchmark with that is, what would I want?
Yeah.
And you can probably guess the answer.
Yes. So yeah, I just wondered if you had seen that before as well.
No, the only experience I've got of anything similar to that is, and I've seen this a few times happen in the groups when we're doing the practical sessions, when you're pumping under the arm, so step 6, you pump 3 times under the arm. I've seen this happen a few times where the person in the chair who's having the treatment goes, "Oh, I felt that."
Oh, okay.
And it's as if they report feeling something, as if it just goes. Premenstrual type, when you get that sort of engorged breast, heavy breast feeling, that premenstrual. I've seen that happen a couple of times in that, and it's taken us all by surprise when it's happened.
Yeah. Okay, great. I have one more question, a quick one.
Yeah.
On your measurement sheet for when you have on the side the distal and proximal, and you have on your sheet you have a number written in there for 18.5 centimeters. Was that the distance from the nail bed?
Yes, it was.
Okay, so if you're doing the feet, you
Top
do the
left-hand corner of the page. Yeah, it's up there, 18.5. Yes, it was. So if you're measuring the feet, just going to get my ruler. If you're measuring the feet or legs, they're actually much harder to measure. But this is the outer edge of the foot, and this is how I would do it. In fact, it's not a great foot. I've been ordering plastic feet lately. So if this is the floor here, if it's on the floor, then I would put the ruler the end of the ruler flat on the floor, with the foot flat on the floor, and I would go to 2 centimeters above the ankle, and that would be my fixed starting point.
Mhm.
Okay, so in the same way, you go 2 centimeters above the wrist, because you want to be halfway up the first 4 centimeter cylinder. That's end of the ruler on the floor to 2 centimeters above the ankle. That would be your first distal measurement, and then every 4 centimeters after that.
Okay, and then all we have to fill in on that sheet is the circumference measurements going
Yes,
up.
yes.
That's it. Okay, thank you.
You're welcome. Thank you. Anybody else have any questions? Amanda?
So going back to, hello, hi. Going back to the cellulitis issue.
Yes.
So some people, I believe, are on long-term antibiotics, so it becomes a chronic issue rather than an acute issue.
Yes.
So bearing in mind that that is, you know, they're permanently presented with cellulitis, is that then contraindicated, or?
No, it's only contraindicated if they've got cellulitis at that time.
So if it's in its acute?
Yes, if it's in its acute phase, yeah.
Okay.
Yeah. Because if the lymph nodes have been removed from a limb and somebody has cellulitis in their arm, then the bacterial infection can spread through the body, and then they need maybe to go into hospital and have a much stronger dose of antibiotics intravenous.
Yeah. So obviously then if they're on long-term antibiotics the whole time, they're going to have lots of gut issues probably, aren't they, with their...
Well, yeah, but I mean, I'm not qualified in nutrition and things. And
no, but then I suppose that would be another element.
I mean, you could maybe refer them to a nutritionist for some advice about, because you can have tests done for all that and get your friendly bacteria. Yes, yeah, gut health I think is good. Thank you.
Thank you.
Okay, anybody else have a question?
I do, Sally.
Okay, hi Jolene.
Hi. I'm working with a lady who's very large and has been diagnosed with lymphedema, and I was curious too if it was lipedema with her. But I'm measuring her feet, and I had the same question that Jean had, like how to measure that. Do you go to the malleolus and do the 2 centimeters from the malleolus?
Yes, anywhere that's kind of approximately 2 centimeters above there, because what you want to be measuring is then a series of 4 centimeter cylinders. Mm-hmm. By going 2 centimeters above, then the 2 centimeter mark is where you take your circumference measurement, because it's halfway around a 4 centimeter cylinder. So I would pick a nice round number. Let's see. So the top of that plastic foot there says 10. Rather than trying to go 10.4 or 11.2, I would keep it to an easy number, easy to replicate, and then always use that fixed starting point and use it for both legs as well.
And how would you handle like the skin folds, because her legs are pretty large, and when you're measuring up the leg?
I have to say I probably wouldn't measure.
Okay.
Because it's quite a difficult thing to do, and really time and her time is better spent in the couch receiving the treatment.
Okay.
And also there's a limit to how much fluid the body can return back to its circulation at any one time. So when you remeasure, you might hardly see any difference in very big limbs. But she will feel better. It's avoiding any, well, there hasn't been much change. It's sometimes better to just let someone say, or I feel lighter, or my legs feel lighter, or my shoes are looser, or any of those sort of things. So to pick up on those things as an outcome can be better. So I probably wouldn't measure very big legs because it's also very time consuming.
Yes, it is. Yeah. Okay. Thank you.
Okay, you're welcome. Anybody else? Hand up for hand up for a question, and then I'll ask you to unmute. No questions? Okay, Angela, thank you.
Sorry, I didn't want to be greedy and take over all your time, but I've just been told today a friend of a friend, unfortunately, has just been freshly diagnosed with breast cancer, and it's quite aggressive. It's gone to her lymph nodes. This poor lady, I feel, would benefit from reflexology, but am I safe to help her at these early stages? I don't want to, cause any detriment to her treatment or her health, but I feel I want to reach out to her, but am I safe to do that?
Well, I've worked on people through all stages of cancer journey, from diagnosis before they've had treatment, people who have aggressive cancers where they need to have chemotherapy before they get the surgery, then they have more chemotherapy and radiotherapy. And if you think of it this way, that how stressful that diagnosis is, and the fear, all of that, if you consider that and know that the body can't be in that fight or flight stress situation at the same time as they're in that rest and digest, heal and grow. So I think anything that you can do to help someone just have a little bit of respite, a little bit of relaxation while feet are in your hands has got to be good.
Oh, that's good. And does it matter if it's weekly, or again, would you worry about the frequency?
I probably wouldn't, but on the other hand, I mean, I'm not in favour of commenting on individual cases that I don't know, but this is just a general discussion. The patients that used to come into the clinics where I worked, they used to come in weekly while they were going through all this and have something, but nobody ever had an hour.
No.
Mostly because there kind of wasn't time, but you can do an awful lot for someone in just 20 or 30 minutes.
Thank you. I value your opinion because I know that's where your area of work has been.
Angela, the reason I'm a reflexologist is because I had reflexology all the way through my chemo when I was diagnosed with breast cancer 15 years ago.
Okay.
And I had it 2 weeks out of 3, and the only reason I didn't have it it was actually the first week of each cycle was because that was the week I had my chemo, and that was the day she was in Dorchester. So I had it the following week when she worked on my immune system, and it was just classic. It was nothing. It was classic IIR, Ingham trained reflexology, and then I had it in what I classed as my good week when I could actually function. And I am absolutely convinced that it stopped. I was able to do 18 weeks straight rather than got bumped, and it's why I do what I do today. So
thank you so much.
Go for it.
Thank you so much.
We will love you for it.
Oh, thank you. Thank you.
Thank you for sharing, Isabel.
Thank you.
No problem.
Yeah. Something that comes up from what Isabel said there, when you are working with people who are going through chemotherapy, you have to consider where they are in that cycle. So as Isabel said, she had 1 week where she couldn't function at all, and some people might not feel like having it then. So I think take each person as an individual, see how they're coping with everything, and like Isabel says, I would also like to think that because of the reflexology, you didn't miss a treatment, you didn't miss a week, and I bet you it always gave you something to look forward to each week as well.
Absolutely.
Yeah, and look how many people you've helped in the 15 years since. So that's thank you.
Yep.
Thank you for sharing. So we've got another 10 minutes, or another 12 minutes, if anybody has any questions.
Sorry, Sally, when my internet connection went completely at the point when you were showing how to measure the foot from the floor. So what I have always done is bend the foot to find the crease, and then measure two centimeters above, and then measure from the bottom of the nail to get the original measurement. But you did something with a ruler at the side.
What I was showing,
I don't know why I'm doing this with my hands, sorry.
that's all right. I think we use our hands to work, don't we? So we talk with our hands as well. So I would put the ruler end of the ruler flat on the floor and just go to 2 centimeters above there, but for consistency.
Okay.
But if you've been doing it that way, the other thing is you'll be used to that foot. You'll be used to where the fixed starting point is. And
Okay. Thank you.
I'm sure that's fine. Anyway, you're welcome. Thank you. So somebody dropped out then and everybody moved around, but there was somebody who had their hand up. You've all moved around now. Does anybody have any questions? No? Any at all? Don't be afraid to ask. No? Would you like, if nobody has any questions, or maybe you don't like to ask, would you, oh, hang on, there's a chat box. I haven't seen that. I've been talking away. Okay. Okay. So this is a question about working. Would it be okay to incorporate the RLD into a usual reflexology routine? Some of the movements seem similar to those that I've learned on a normal treatment. Yeah, so when you're training, I do think we all need to learn a set routine when we're training. You know, we have a foot map and we follow that, and we need to do that when we're learning. But I think the more feet you get your hands on, that's when you really learn that it's okay to deviate. You also stop seeing the foot as a two-dimensional, you know, the map on the foot, and you start thinking more three-dimensionally when you're working. But that will come with experience. But just be confident in your training and just get hold of as many feet as you possibly can, is what I would say. Just, so yes, RLD can be given as a standalone treatment. You can use elements of it, or you can use it to work the lymphatic system. So I hope that answers your question. Thank you. Just make sure. Okay. Oh, somebody had to go. Okay. Okay. Oh, we got Sue. We got somebody from South Africa as well. Lovely. Thank you, everyone. Okay. Sue, hi. Do you have any questions from South Africa? You might need to unmute so I can hear you.
Hi.
Hi, welcome.
Yeah, thank you. I don't have any questions at the moment. If I think of anything, I'll share.
Oh, sorry, I thought you had done a hand signal. That's fine. Okay. Well, we have just a few more minutes if anybody's got anything else you'd like to add.
Can I just ask how it's going with the online training versus the in-person training? I'm just curious.
Well, I have to say, good question. Had the first one not been okay, in fact, more than okay, I wouldn't have done any more.
Okay.
It's been exceptionally well received. Exceptionally well received. Yeah, otherwise I wouldn't be doing it, because I really want people to get this. I want more than anything for people to really understand it. And I think because of the book, having the book
And the video.
And the video, everything is there to refer back to as well. I've got some new material that was part of another project I was doing since publishing the book last year. So I've been able to use some of that material as well. Yeah, so, but thank you. I mean, I couldn't have imagined doing Zoom, teaching it online, but what it has done, it's enabled people to join who wouldn't have been able to get to classes.
Yeah.
Well. And you get these lovely groups of people together joining you from all over the world. And I think when Jolene joined. Was it 2 in the morning where you were, or was that somebody? We've had people.
Yeah, I had to get up at 4.
Yeah.
Morning, but yeah.
Yeah. So it's been really lovely having, and people have joined from South Africa who wouldn't have been able to get to the course. So I love the idea that it will progress now and help more people this way. Because I've also set up a closed Facebook group to support the online learning, and we do a 1-hour Q&A follow-up about 4 to 6 weeks afterwards as well.
Have you thought about buddying people up with people who've done the face-to-face training?
Yes, I mean, sometimes there are people on the online stuff who live near each other. So,
right.
Yeah, 3 people in Scotland this week all live near each other. Some of them didn't know each other. So it just seems to be, with reflexology, how synchronicity just happens.
Yeah.
And it just all seems to be.
It's odd because I did it was a 1-day course with Moss Arnold and Sharon Windle. Yeah. And it's the first time I've done an online course, but actually it works really well, surprisingly.
Yes.
I mean, okay, my laptop had to be in a slightly precarious position to show Moss and Sharon what I was doing on my husband's feet, but it did work.
Yeah, it does work. And we have these technology issues, but we just wait and it gets sorted. And it's been an unexpected pleasure, really.
Good.
Really has. So thank you. Yes, thank you. And people have said they've enjoyed not having to travel somewhere as well, or not have to stay overnight in a hotel, and being able to just focus. I think you have to concentrate more because it's online, so it's important to take regular breaks and things, but it seems to be the formula seems to be working well.
I know several people have commented that there's no, even though they're based in the UK, you were so fully booked that they wouldn't have gone to the course until sometime next year anyway. So this brought it forward. So they were thrilled. So yeah.
Thank you. Thank you. Okay, does anybody have, last couple of minutes, any more questions from anyone? No. Well, just to say thank you. You're welcome to unmute if anybody wants to speak to anybody else, if you want to speak to each other. Have you found this helpful? Is it helpful exercise?
Absolutely.
I might do this again then. Thank you. Well, thank you everyone for joining me and giving up an hour on a Friday afternoon. I hope you all have a lovely weekend, or in the middle of the night in Sydney.
It's lovely to see how far afield everyone is, and how RLD is spread across the world.
Yes, it is. Research now, I mean, so for Sandy, you won't know, probably won't know about the research. Our next paper is due to be published next month in a British Journal of Community Nursing, and it's thermal imaging study, a pilot study of thermal imaging that we did. And we've done more research since, where we've had 2 groups. One had a standard reflexology and one group had RLD. All were breast cancer related lymphedema. They were all people who hadn't had reflexology before, so they didn't know which group they were in. And the results are fantastic. So that will be the paper after that, due to be published. So the university really are putting a lot of effort into this, and Judith Watley is doing a fantastic job driving it. Yeah, so I do think they'll need us. They'll be begging us to go and work in the healthcare service, hopefully, because they'll realise what they're all missing. Anyway, thank you everyone for joining me. I'm going to end the recording. I'll do that.
Thanks, Sally.